A client with iron deficiency anemia is taking an oral iron supplement. The nurse should tell the client to take the medication with. The options are A. Orange juice, B. Water only, C. Milk, D. Apple juice. Answer is option A. Orange juice. Iron is better absorbed when taken with vitamin C. Orange juice is an excellent source of vitamin C. Which of the following postpartum patient is at greatest risk for hemorrhage? A. Gravida 1 para 1 with an uncomplicated delivery of 3 kg infant. B. Gravida 1 para 0 with a history of polycystic ovarian disease. C. Gravida 3 para 3 with a history of low birth weight infants. D. Gravida 4 para 3 with a caesarean section. Option D is correct answer. The multiparous client has the greatest risk for postpartum hemorrhage. A nurse is planning care for a patient with adrenal insufficiency. Which nursing diagnosis should receive priority? The options are A. Fluid volume deficit, B. Sleep pattern disturbance, C. Altered nutrition, D. Alterations in body image. The answer is option A. Fluid volume deficit. The patient with adrenal insufficiency suffers from fluid volume deficit and acidosis. An adult is admitted with chronic renal failure. Strict intake and output is ordered. The patient is sometimes incontinent, so it is impossible to obtain an accurate record of output. How can the nurse best assess the patient's fluid status? The options are A. Estimate the amount voided each time, B. Observe her skin turgor, C. Weigh the client daily, D. Record the number of voidings. The correct answer is option C. Record the number of voiding. Daily weights are the best way to assess fluid balance. Estimations of the amount voided are usually not accurate. The nurse is taking vital signs on a very obese individual and uses an extra wide cuff. What is the primary reason for using an extra wide cuff? The options are A. A regular size cuff is not going to be long enough to go around the patient's arm. B. Blood pressure taken with a cuff that is too narrow gives an artificially high reading. C. A regular cuff is too tight and causes discomfort to the client. D. A narrow cuff causes the client's pulse to be elevated. The correct answer is option B. Blood pressure taken with a cuff that is too narrow gives an artificially high reading. Following a craniotomy, the nurse positions a client in a semi-reclining position for which reason? A. To promote comfort, B. To promote drainage from the operative area, C. To promote thoracic expansion, D. To prevent circulatory overload. The correct answer is option B. To promote drainage from the operative area. The semi-reclining position will promote drainage from the operative area and prevent cerebral edema without putting undue pressure on the cerebral structures. The major goal after craniotomy is to prevent cerebral edema and increased intracranial pressure. The nurse observes that an elderly man who is bedridden has a reddened area on his coccyx. The skin is not broken. The nurse most correctly interprets this pressure ulcer to be which stage? The options are A. Pre-ulcer, B. Stage 1, C. Stage 2, D. Stage 3. The correct answer is option B. Stage 1. Pressure areas that have color changes and changes in skin texture with no break in the skin are assessed as stage 1 pressure ulcers. Stage 2 ulcers have a break in the skin with involvement of the dermis. Stage 3 pressure ulcers involve the subcutaneous tissue. Stage 4 bed sores are severe form of bed sore. In this stage the deep wounds that reach the muscles, ligament and bones.